Learn about the approach and troubleshooting of spinal anesthesia in the lumbar area and the thoracic area using this model. As you can see in the lumbar area, the spinous process, if I show you from the lateral side, they are parallel to each other and horizontal. So if I insert the needle in the midline and horizontal, so it will pass through them easily. Whereas in the thoracic area, you can see that the spinous process are pointing downwards. So if I insert my needle, it will keep on hitting either this spinous process or the above spinous process. So if I insert my needle like this in such a capillate direction, then only there is a possibility that it will go like this. Even then, suppose you have inserted a bit inside, and still it may keep on hitting the upward surface of this below spinous process, or it may hit the under surface of the above spinous process. So it has to be very parallel to these spinous processes, which is very difficult to actually do practically. That is the reason why in the lumbar area we can follow a midline approach. You can easily insert in between these spinous processes, whereas in the thoracic area you have to take a paramedian approach for ease of insertion. That means if this is your spinous process, you palpate the spinous process, you go 1 centimeter lateral, 1 centimeter below, and from this point in the skin you keep your needle medial directed and capillate directed. That way, if you insert, that needle will go into the foramen easily. So if I show you laterally, this space, you can see it can be easily approached through this paramedian approach in the thoracic area, not from the midline. Similarly, if I tell you about the troubleshooting, if you are hitting a bony process just immediately next to the skin, that is a spinous process. But if you are going inside and then hitting a bone, it may be the lamina here, it may be the facet joint, or it may be the transverse process. So if you can see, this transverse process is actually deeper to the facet joint. See, if I show you from here, this transverse process is deeper to the facet joint, whereas again the lamina is deeper to the facet joint. So in the lateral, if suppose you are not aware of the midline, if you are hitting it something at particular depth, you're going lateral and it is getting inserted inside and again hitting a bone, but it is slightly more deep to this structure. And again, if you go medially and if it is slightly more deep compared to this structure, that means you are hitting the facet joint, and on this side is your transverse process, on this side is your lamina. So you are too lateral to everything. So you have to the medial side, hit the spinous process, and then actually change your direction like this, above, just above, or just below. Or you can follow a paramedian approach and go in your medial direction, so it will enter into the foramen.